Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 3 of our course in the Theoretical Foundations of Nursing Education. And once again, a very nice week of discussion. The discussions this week focus primarily on the various learning theories and models and paradigms of education, and delved a little bit into how each of you perceives education, or how each of you perceives how education should be presented. There's many different models of education, and the choice of a model is important um, because it really is the foundation. It is the framework, the structure around which a teacher builds their entire educational curriculum. And there can be vast differences in the way that that can be done. For example, if you're a cognitivist or a behavioralist, your classroom is going to look much different than somebody that follows a social learning theory. Social learning theory essentially says that we learn from each other and that we model our actions off of each other. And that's important in nursing education in particular because, for example, the selection of a preceptor that we have that is educating a new novice nurse, that preceptor has a negative attitude, doesn't communicate well with patients, and is not a very socially adept person, that student is going to also learn to have a negative attitude and probably not be social adept. A behavioralist and cognitivist would have a classroom that looks much different because they are setting up a classroom where individuals are probably mostly reading in books and memorizing information and then performing any number of tests to see how well they did in that particular, in that particular class. For myself, just the fact that I'm using this video and the fact that at SHU in our online courses we encourage a lot of discussion. That's an example of this social learning theory. We try to make it as social and as interpersonal as possible. Um, and so overall, a very good discussion. Again, we're once again laying a good foundation. And so the grading for week 2, I'm anticipating should be done sometime later this week, definitely by the weekend. The discussion questions will be graded first, and then your written assignment that you completed this week will be all done before the weekend, certainly. But you can go ahead and look forward to those. Now on to week 3. In week 3, we start your next written assignment, which is you are going to be developing a teaching plan, and you're going to be developing your own course and find your own materials and come up with your own objectives for a course that you're going to teach in nursing. Now, I'm not going to go over the rubric real specifically here, but please refer to the rubric and refer to the syllabus for the specifics of the assignment. In week number 3 in our discussion question, we start on one of the most important parts of this assignment that is actually due in week 4. It's not due, I should clarify, it's not due in week 3. You start it this week, but it's going to be due in week 4. But in week 3, we discuss course objectives and how to write course objectives. Course objectives are important because they are essentially the outcomes that you are looking for a student to gain at the end of whatever educational class or program that you come up with. And objectives can be written for a particular assignment, for a particular week of a course, and then for the course itself. And they should align with what are known as the student learning outcomes. Now, we're not talking about student learning outcomes as yet in the course. We call them SLOs in education. They're kind of sort of the new buzzword in nursing education, and many of us that work in nursing education have been coming up with new student learning outcomes. It's kind of the big accreditation thing right now. But the outcomes are that tangible, hands-on, what do you want a student to be able to do? Where course objectives are more what are the outcomes that you want the student to learn. In other words, they don't have to really be proficient at it yet with an outcome. In a student learning outcome, it is a certain amount of proficiency needs to be gained. In a course objective, we're really looking at something that is more, more cognitive in nature, more of a particular objective is met that will help the student to achieve some outcome in the future. And so the objectives are those things that you want a student to learn. A couple things to keep in mind is objectives should always be measurable and observable, just like a nursing objective. Or like when you're doing a treatment plan, you need to not just say that for example, it really isn't good to put in a care plan that the patient will gain health education. You should say more specifically that the patient will learn 3 ways of controlling diabetes that they didn't know before. Something like that, where you can actually say, did they or did they not make it? Likewise, an objective needs to be written in a way and with verbiage that indicates that the student either made or didn't make the objective. So you want to avoid terms like, the student will improve their ability, or the student will relate feeling a particular way about something. It should be more specific, that the student will be able to identify 3 new learning theories, for example. Those would all be example of well-written objectives. And there's many course materials for you to review this week, so I'll kind of leave it at that. But overall, a very good job, a very good week of discussion, very good week of work. I look forward to participating with you once again in class. As you have any questions, please feel free to pass them along either in the Ask Your Instructor discussion or via email, and I look forward to seeing you in discussion forums.